So I'm Dr. Nancy Kim with Spectrum Dermatology, and I'm joined by my patient Nancy, who's graciously volunteered to be here today. Today we're going to talk about Botox. Botox is an injection which essentially relaxes the muscles and basically helps erase lines of motion. And so today we're going to talk about the three most commonly injected sites. And the number one most injected site is the glabella right here. So Nancy, I want you to go ahead and give me a big frown. And so you can see here that she's making some lines, and we call these the 11s. And these lines make people look very angry or upset. And so really injecting and sort of relaxing these lines gives people a more relaxed, happy look. And essentially we would inject in a few sites in this area, and that will prevent her from making this motion and therefore actually raise her eyebrows up, giving her a more open look. So the other site that we inject with Botox is the forehead. So go ahead and raise your eyebrow up, and these are these horizontal lines that you see here. And a lot of people really don't like these lines. So oftentimes we'll inject the Botox up in the forehead, approximately so, and that will actually relax these lines such that she's not able to raise her eyebrows. The third site that we inject with Botox is really here in the crow's feet region. So go ahead and smile for me, very large. And you can see that as she smiles, which is a normal thing, that you form these lines right here. So if we inject here in this region, we can actually relax such that she doesn't make those smile lines. So let's start off with doing a little bit of prep on the site. I'm gonna do a little bit of alcohol. It's a great procedure because there's essentially minimal to no downtime. So I'm gonna give her a squeezy ball, which I always like. Here you go, Nancy. I find that that helps me a lot with my injections. And we're gonna put her feet up and we're just gonna go for it. So it's a tiny little needle, so it's really not very uncomfortable. There's really no downtime. Typically Botox lasts about 3 months from the time of injection, and it doesn't kick in right away. So right after you get injected, you will still be able to move, but usually within about a week, you'll notice that that will start kicking in. How are you doing, Nancy?
Very good.
I always tell people that they shouldn't expect to have no lines at all, because they're still going to have some motion, because if you inject too much, you can get that frozen look, which I think most people don't really want. They want to have some lines of expression, but they just want it to be relaxed. So that was essentially it. We basically covered all of the sites. We got her 11s, we got her crow's feet, and we got the forehead lines.